Welcome to One-on-One. I'm Steve Adubato. We're coming to you from the Agnes Ferris NJTV studio. We're pleased to welcome Dr. Tom Thomas, Director, Head and Neck Reconstructive Surgery and Transoral Robotic Surgery at Atlantic Health. Good to see you.
Good to be here, Steve.
You and I were just talking before we got in the air. I want to jump into that topic. HPV virus. What are we talking about, and why is it a critical issue?
So HPV is a sexually transmitted disease. It's over 200 varieties of them. There's 2 to 3 of them are extremely important. At least as a head and neck surgeon, they cause 90% or more of the throat cancers that we are diagnosing nowadays. So my partner, Eric Cohen, and my team at Morristown Medical Center, Dr. James Wong of Radiation Oncology and Misak Huygens of Medical Oncology, and other professionals work together as a team in a multidisciplinary way to treat this epidemic of HPV-related throat cancer that we are seeing.
You're calling it an epidemic.
It is.
Why?
Because in the last 10 years, it went from 17% of the cancers of the throat to over 80%. And it is seen, especially in the developed world, especially in UK, Eastern Europe, and Australia, and it is slowly spreading to the other parts of the world.
A national, international crisis.
Absolutely it is.
Can the virus be treated?
So we have 3 different vaccinations that has been available since 2006. And we have seen efficacy of eradicating the infection over this time, and the indication has expanded now to boys and girls and to even older adults.
Okay, I'm curious about this. We've been having conversations with several medical professionals about vaccines. Now, young people 11 to 12 should be getting what?
So we should be giving them the HIV vaccination that is before they become sexually active. So it has the capacity to protect them from developing it or decreasing the infection of it. That's the reason for giving the...
Sorry for interrupting, Dr. Thomas. What do you say to those who say, you know, you shouldn't be talking to 11, 12-year-olds about this because it involves sexually transmitted disease, and we don't want to be talking about that to them because we may be encouraging them to engage in behavior that they otherwise wouldn't, you say?
I have 4 kids. I have 3 boys and a girl, and the oldest one is 13. I already vaccinated my oldest child. The second one is a girl. She will get it. Every one of my kids will get vaccines because this is a protein particle vaccine, not a live virus or attenuated virus that you hear about in measles, mumps, and rubella. It has excellent safety efficacy. I have no doubt that patients and people will benefit from it. Because if you don't prevent it, you will pay a price for it 30 years from now.
Yeah, make that connection again. Help us on this, those of us without a clinical background. And by the way, I want to disclose that you're talking about you're connected to the folks at Morristown, right?
Morristown Medical
Which is part of the larger Atlantic Health System,
yes.
Which is one of the supporters of what we do. Question, what is the connection without a detailed, complex, hard to understand clinical explanation of this HPV virus and potential throat and mouth-related cancers?
So HPV,
how does that work?
HPV is over 200 subtypes. We already knew for the last 50 years that some subtypes cause cervical cancer in females. And these cancers, these HPV viruses can land in areas of the epithelium, which is the outer layer of skin, usually in the cervix or in the tonsil tissue in the throat. And then it can integrate themselves into the cells and multiply. But it can stay there for 20, 30 years, and something triggers them to turn into cancer after that. And that's what we are facing now.
So play this out for a second. Now you have to perform surgery because certain things were not done. And I'm curious about this. Minimally invasive surgery in your field. First of all, is that what the word transoral means?
Exactly.
That means minimally invasive?
That's right.
Okay, but for what kinds of cancers, and how? Talk about its efficacy, if you will, its effectiveness.
Sure. In the olden days, the head and neck cancers tend to be a tobacco and excess alcohol-related cancer. The cancers tend to be much bigger in the throat. By the time they recognize and diagnose it, we have to split the lip, split the mandible, open up the neck to remove the tumor. So can you imagine, the bigger the incision, bigger the surgery, longer the recovery, and swallowing function, breathing, talking, all compromised during that part. So Transoral robotic surgery, especially with the HPV cancer, the primary tumor is much smaller. So you can use the natural orifice of the mouth to get to it using a robot and remove the tumor without any major cutting of the bones or disfiguring surgery.
The healing process then is what?
Is much quicker, 3 to 5 days, maybe 7, instead of 3 weeks to 4 weeks in an ICU setting with a tracheostomy tube. Dramatic difference.
The most important piece of this is that people need to be aware.
People need to be
And you're not the only healthcare system, but I do know that you have an HPV Center.
Right.
What is that, real quick, before I let you go? What is it?
HPV Center was created because recognizing this epidemic, public and the professionals don't have a place to go for resources. So we decided to create this center so they can get information and a multidisciplinary access to physicians in one setting.
Atlantic has that.
Atlantic has that.
And it's a resource to everyone?
It's a resource to everyone.
This is Dr. Tom Thomas, who is Director of Head and Neck Reconstructive Surgery and Transoral Robotic Surgery, at Atlantic Health. I want to thank you for joining us, Doctor.
Thank you for having me.
Important information.
Thank you.
Okay, well done. This is Steve Adubato. This is One-on-One, and we'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, Choose New Jersey, New Jersey Sharing Network, Johnson & Johnson, the law firm of Gibbons, P.C., the New Jersey Economic Development Authority, and by Community Food Bank of New Jersey. Promotional support provided by NorthJersey.com and Local IQ, and by BestofNJ.com. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.